Hi, and welcome to this introductory video about quality improvements in healthcare. I'm Dr. Hamer, a clinical psychologist working with the Veterans Affairs Quality Scholars Program. This is a national interdisciplinary program that trains leaders and scholars in the science of healthcare improvement. The National Academies of Medicine identified and defined 6 dimensions of healthcare quality. Here, we will focus on timeliness. Specifically, how we can target this dimension of quality to improve the standards of care and the health outcomes of the populations we serve. Quality improvement requires strategic planning and collaboration amongst providers. Timeliness is necessary, and providing timely access to high-value and high-quality healthcare services should be a fundamental goal of any healthcare system. If you don't improve how quickly patients gain access, you inadvertently create greater healthcare disparities among patient subpopulations. The National Academies of Medicine defines timeliness as reducing waits and sometimes harmful delays for both those who receive and those who give care. Put more simply, timeliness involves the system's capacity to provide care quickly after a need is recognized. This dimension of quality is precisely about providing the right care at the right time. There are data that compare international healthcare systems on several metrics, including timeliness. As you can see, some systems have performed better than others with regard to this dimension of quality. Every healthcare professional heard the language of timeliness that advocates timely access to services and interventions. And even though the language used to convey this is different across systems of care, the core message of the languages is the same and aligned with the mission of reducing the burden of illness, injury and disability, and improving the health and functioning of the people served. A lack of timeliness is often observed in many provider offices when patients are waiting to be scheduled or awaiting services to be rendered. Emotional distress and physical harm may be consequences of delays in diagnosis or treatment. Patients may interpret a lack of timeliness as providers and the healthcare system lacking respect for the people they serve. Waits also plague providers. There may be consistent delays in procedure or treatment start times, or providers being on hold as health professionals track down important information. We often observe extended wait times regarding both patient and provider inquiries, in specialty care, on gurneys and hallways, waiting for procedures, and while awaiting test results. Ultimately, delays and barriers involved in referrals consume the time and energy of both referring providers and consulting specialists. Timeliness is a subcomponent of access. This temporal dimension of access includes time spent waiting in the reception area, time spent receiving treatment, and the wait time for the next available appointment or digital communication. Perceived temporal access represents the self-reported time burden and temporal convenience of receiving services. So, what can we do about timeliness? We can use data to guide improvement in this domain of quality. Some of these data include objective, observable measures, and various healthcare systems do this differently. For instance, some systems measure timeliness between tasks of coordinated care that may span from the time of initial contact with primary care to the time that recurrent treatment appointments are made in specialty care. Timeliness is a complex dimension of quality, as there is no globally operationalized way that systems reliably measure it. To this end, the National Academies of Medicine has put forth a framework for access and wait times transformation that identifies supply and demand as the anchor inputs with performance as the anchor output. A difficulty for healthcare organizations is the coordination of care across patient conditions, services, and settings over time. Evolving information technologies present opportunities to help providers make faster and more accurate decisions by using data, especially when IT departments work alongside providers to understand IT needs of specific sites of care. Further, carefully considered and implemented communication modalities may reduce the professional burden of complicated case-by-case strategies for patient care coordination. Some of these channels may include secured instant chat messaging or intra-organizational alert systems. Open access scheduling systems may reduce burdensome backlogs to help patients see providers for routine and urgent appointments. Additionally, healthcare systems can improve performance by incorporating care coordination processes and outcome measures into their daily workflow. Establishing backlog reduction plans help move systems toward more efficient processes and thus more timely delivery of care. Using these kinds of measures make it possible to understand whether performance is consistent with evidence-based best practices. These measures may also uncover which groups of patients are benefiting from services and organizational processes, as well as which groups are not benefiting. Ultimately, providing the right care at the right time and reducing waits and harmful delays will positively impact patients by giving them access to care they need when they need it. Not only do we observe reduced morbidity and mortality for chronic conditions when systems provide timely care, but we also reduce patient suffering and enhance patients' qualities of life. In summary, healthcare systems may address timeliness in a number of ways. It is of utmost importance to put systems in place to help providers make quicker decisions about patient care. Systematic attempts should be made to ensure that IT works alongside providers to understand what is needed at sites of clinical care. For this dimension, you should support organizational needs to meet supply and demand and performance metrics as well as your own need to make informed decisions by generating data. When addressed properly, timeliness improves patient health outcomes, enhances treatment engagement, and reduces patient suffering.